So you go for your annual checkup. A dozen tests are done and you feel secure. But here is the hard truth. Most routine tests are unnecessary unless you have a reason. So even worse, this test can get missed or can lead to more tests that might harm you. So this is your guide to truly what is worth and what you could do to avoid wasting your time and avoiding wasting your money also. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Nderitu, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at the truth about the annual checkups. What are the tests that are worthy doing, and how often should you do them, and what is the value of doing them. So, we are looking at the tests that are worthy doing. So, one is your blood pressure checkup. This is one test that you should not miss out, and preferably you should do it every 3 months. Just going to the facility that is near to you or wherever you can get your blood pressure checked. If possible, you can also get your blood pressure machine, but you do not need to check the blood pressure on a daily basis if you do not have hypertension. And remember that hypertension does not cause damage on your organs and tissues in a single day. So checking your blood pressure every 3 months could be life-saving. And this one check could help you check one of the silent killers that is known to cause a lot of complications on people. Then the blood sugar test. This one you need to check it every 6 months. Especially if you are over 40. And if possible, you can also check your glycated hemoglobin, which shows you your average blood sugar for the last 3 months. It prevents type 2 diabetes complications, and you'll be able to get it to know how your sugar is before complications are set in. Then your lipid panel. This you can do it on a yearly basis so that you get to know how are your cholesterol, and this helps you to reduce the risk of heart disease and also the risk of stroke. So these are some of the very necessary tests that you need to do, and that is the frequency that you need to do them. Then cancer screening, the pap smear for ladies. How often should you do these tests? Preferably, if you are HPV negative, you can do this test from the age of 25 to 65 every 3 years. And if you have tested negative for HPV, then you can do this test every 5 years. Then the mammogram, you need to do it every 2 years if you are over 40 years, and if there is a family risk of breast cancer or ovarian cancer in your family, then you need to do this test every 2 years. The prostate test for checking prostate cancer. Before you do the PSA, the test that checks for prostate cancer, you need to discuss this with your doctor, because this is not one of the regular screening tests that every man should have, but you need to check what is your family risk. What are the chances that you could be having prostate cancer? You need to look at the symptoms, look at the risk, and your doctor can also do a digital rectal examination, and this will help you know, do you need to do the PSA or you can do it later. Because one of the other things is that prostate cancer is one of the slowly growing cancers, and not everybody who needs to be screened. So it is important that you discuss this with your doctor and see the pros and the cons of doing this test, and then you can decide, do you need to do it or do you need to delay up to a later date. But from the age of 45, you need to have this discussion with your regular health provider. Then stool test for blood, or what we call the occult blood in stool. You can do it from the age of 45 years. It helps you to screen for the possibility of colon cancer. And if your occult blood in stool is positive, then you do a colonoscopy. If you do one negative colonoscopy, then you can comfortably do a colonoscopy every 10 years, and you can be sure that you are safe unless anything changes. Then there is your body mass index and your waist circumference. This you need to do it every 3 months. Helps you to check how is your weight, how is your abdominal belly fat, and is it putting you at risk. This predicts your risk of getting diabetes, predicts the risk of getting metabolic syndrome, also predicts your heart risk, and also helps you to determine what is your risk of getting cancers that are associated with obesity and increase in belly fat. So some of the tests that you do not necessarily need. If you do not have any chest symptoms, then you do not need a routine chest x-ray. It does not help much. Doing annual full body scans, it is not necessary unless you are looking for specific risk. Then urine tests are not very necessary, and they might not be very helpful. Doing echoes and ECG, unless you have diabetes or hypertension, they are not necessary. They might just lead to false alarms and unnecessary anxiety, and also make you use a lot of your money unnecessarily. So let's be guided by science, and let's be guided by logical screening. So remember that you need to have a real conversation. The most important thing is you need to have a regular doctor who sees you, whom you can discuss your health issues, and knows your family history, knows your risk, and also knows your numbers. What is your blood pressure has been? How has been your blood sugar? And then prevention is not just about the test. The real prevention of diseases is in your home, is in your lifestyle. So before you even think about the blood test, before you even think about the pressure checks, are you eating healthy? Have you tried to cut the sugar in your life as much as possible? Have you tried to cut on the refined carbohydrates as much as possible? Have you tried to cut as much as possible of the sugary drinks in your lifestyle? Have you worked on your social connections? Are your relationships okay? Are you sleeping adequately? Have you known how to deal with the stresses in your life? These are the critical things that you need to fix in your lifestyle, and you do not need to go to the doctor to be able to fix this. You need to have the intention and the right knowledge. You need the right knowledge. Go check on the Overall Health YouTube channel and subscribe, and also hit the bell on the screen so that you can be informed when we release new content. And this will be able to help you on some of the lifestyle modifications that you need to change. So look at your nutrition, look at your movement, and look at your mental health. So annual checks helps when they are personalized, and you just don't do it like a one suit fits all. So get smart, get screened, and stay alive. So ask your doctor, what test do I really need, and because of my age, and how often do I need to do them depending on my risk. Do not demand everything. Demand what matters, and share this information with someone who is blindly following the outdated health routines. So one test can save your life, but the wrong test can also waste your life and your money. Be informed, be proactive, and be smart with your health. That's what you need. Subscribe and follow the Overall Health YouTube channel for more health tips. Thank you.